Hello, this is Dr. Trivedi, a doctor working here in this clinic. May I confirm your name and age, please?
Hello, doctor. My name is Gert Khali, and I'm 45 years.
Okay, how may I address you?
Please call me Khali.
Okay, Mr. Khali. Today we are going to discuss about your health issues. Is that all right?
Okay, doctor.
Okay, can you please tell me in your own terms what's troubling you? Okay,
Doctor, actually, for the last 3 months, I am having a headache. And headache is something boring and more at in the morning time. I'm really in a big trouble with that. And also after that, having this headache, I visited my GP, and he prescribed me some paracetamol tablets, but that is not helping me. And at the time, he also measured my blood pressure and said that it is very high. And for this,
yes, yes,
there might be something reason for it, and he sent me.
yes, I can get it. May I know that is there any specific place of the head where is this pain occurs, or
No,
whole head?
all about that.
All over that. Okay, did it come along suddenly or gradually?
Gradually.
Okay, and has it increased in frequency? For how long does that persist? Can you please tell me this headache?
For the last 3 months.
Okay, and all the time, or does it come and go, this headache?
No, it is more in the morning.
Or in the morning? And has it been the same, or do you feel that it's increasing, this headache?
Slightly increased, but I think it is stable now.
It's stable. Okay, and can you please describe the pain? How is it? How is the pain?
Dull and boring.
Okay, and if you how would you grade it if I tell you that 0 is no pain at all, 10 is the highest grade, and then how will you grade it?
I will
This
grade
pain?
with 4 out of 10.
4. Okay, and do you think that there is anything that makes it worse? Any coughing, sneezing?
No.
Okay, anything else that makes it worse?
No.
Okay, anything that makes you feel better?
I haven't noticed.
Okay. May I ask you that have you ever felt any flushing of your body or of your head or body?
No.
Okay, and may I ask you that have you noticed any change in your vision?
Yes, doctor. For last couple of months, for the last 1.5 months, I noticed that I sometimes I bumped when I enter or out of my car.
Okay, I can get it. And okay, and have you noticed any changes in your shoe or shoe size or ring size recently?
Yes, doctor. I am a sportsman, so I also, but I noticed these things, and I don't know if it is abnormal. They are somewhat bigger now.
Okay, and for
Hello.
for how long have you been also? Yeah. So
I think for last 2 months.
okay, for how long have you been observing this change in your shoe or ring size?
For last 2 months.
Okay, and do you have you recently been facing any sleeping problems?
Yes,
Have you?
that is also. And I told you that I bumped into cars, and sometimes I also noticed that I am falling asleep while at my at a road signal, and also I feel that I do not get a good sleep at night.
Yes. I can get it. And do you feel any pain in your hand? Have you noticed anything?
Sometimes, doctor, at night,
Okay,
something
and
numb, not pain.
okay, now whole hand or just any part of it?
No, part of
Out of
my hand, I think, over my finger, that is numb.
Mhm. Yeah. Well, have you ever measured your blood sugar level recently?
No.
Okay, and how are your bowel movement? Is that all right?
Yes, doctor.
Okay, and have you ever noticed any blood in your bowel movement?
No.
Okay, and do you feel any difficulty while getting up from a sitting position or raising your hand above your head? anything like that?
Sometimes I think that it is become somewhat difficult.
Okay. Yeah. And do you feel any? Do you have any problem of indigestion? Have you noticed anything recently
No,
or something like that? Okay. And any pain in your tummy, severe pain or cramping
no.
pain? Okay. And what? How about your water work? Is it all right?
Yes, I think it's fine.
Frequency, is it all right, or amount?
No, I think somewhat increased in frequency. I have to
Increase in
wake up at
frequency. Okay.
night about 2 to 3 times
Okay. For how long have you been feeling like this?
for last 3 months, I think.
Okay. And now may I just examine the patient?
Okay.
Okay. First of all, I would like to expose the patient. Okay. And then after taking examination, I would like to have a close look at the patient, at his eyes. Okay. And I will tell the patient to open his mouth, and then I will go side by side to look whether there is any protrusion of the lower jaw, and
Yes,
also,
it is from side.
yeah.
This is from side view.
Yeah. So there is some protrusion of the lower jaw,
Yes.
and also some, I think, some prominent supraorbital ridges that can be seen here.
Yes.
And I would like to then I would like to uh, look for the eyesight. Okay. Whether there is to do the waving, the field of vision test. Okay. uh,
Okay.
is that normal?
Now there are bilateral bitemporal hemianopia.
Okay, and I will also like to do the prayer sign and reverse prayer sign in the median nerve testing. Okay, keeping the hands
That brings the tingling sensation.
okay, and tingling. Okay, and also would like to tap the hand, and then I would like to I would like, okay, and may I know that what is your concern is?
Why I am having this, doctor?
Sorry, and I would also like to have a look, have to auscultate the heart. Okay, and
Okay.
hospital the heart in this patient.
Normal.
Okay, and also have to want to shake the hands to see whether there is any sweaty, doughy hands or not. Sweat
Yes.
like hands. Yes. Okay. May I know what your concern is?
Why I am having this, doctor? Is this
Yes.
due to my excessive muscle building, or I am taking a testosterone for muscle building? Is for that?
Yeah. Actually, hmm, and as long as I have taken history and examined you, I think that you might be suffering from a condition named acromegaly. Don't bother about the term. Actually, there are many chemicals in the in our brain. Okay, brain gland. So sometimes there is one chemical that is responsible for our growth and feeling of well-being. It can increase. Okay, uh, so. Uh, your symptoms can be caused by the increased secretion of that chemical, and also you have complaints about some water work problem. So we will actually, for this, at the beginning we will actually confirm that growth, that chemical abnormality, by doing some blood tests. Okay, and also some scanning of your brain. And at the same time we will also look that at times this problem can be associated with some other conditions. Okay, for that also we will also it is called Main syndrome. Don't bother about the term, but sometimes some other glands of your body, okay, like your neck gland, some glands around your neck and some other glands can get involved. So we will also run tests about that also. And after that we will uh, consult the hormone specialist for your treatment purpose. Are you getting me,
Okay,
Mr.
doctor.
Do you have any more? And at the same time, may I know, do you drive?
Yes.
Yes, it would be better to stop driving as long as we make confirm the diagnosis, and then we can map out a plan for you. Okay,
No.
about your driving. Is that
Time
all
up.
right?
Okay.
Okay. Any more concerns?
No, thank you.
Okay.
What is your diagnosis?
I think the diagnosis will be main one syndrome, I think,
Why?
because the patient has features of acromegaly manifested by prominent supraorbital ridges, bitemporal hemianopia, and lower prognosis of lower jaw, also sweaty hands and features of CTS, carpal tunnel syndrome, and OSA. And at the same time, he has some complaints about his urination. He told that there has been increased frequency of urination. This polyuria might be a feature of his parathyroid involvement, I think. So I would like to go for MEN 1 syndrome.
Okay. Why? How will you investigate him?
Okay, first of all, to diagnose acromegaly, I will have to do some OGTT with growth hormone level testing, and also would like to do the serum IGF level, insulin growth factor 1 level, and also MRI MRI scanning of the pituitary gland. And at the same time, I might also do serum parathyroid level and serum parathyroid level, and also some tests like serum gastrin levels and serum insulin level also. Insulin and C-peptide level also.
How will you manage him?
Yes, I think the main management will be surgical, although there can be some medical management as well, like some somatostatin analogs like octreotide and also dopamine agonists like bromocriptine, cabergoline, and also receptor antagonists. Okay, the growth factor receptor antagonists like pegvisomant, and at times some radiotherapy can also be considered, I think. I think this will be the main treatment for acromegaly, and if it is confirmed as MEN syndrome, we might consult with the surgeons, ENT surgeons, ENT specialists, to whether parathyroidectomy would be done or not.
Okay, fine. Thank you.
Okay.
For this gentleman, actually, your history taking was fine, and I forgot to give you the picture of the patient birth.
Yeah.
Okay, so history taking was fine. You reached the diagnosis. Just one thing, you haven't asked about any past medical history. You haven't asked
Yeah.
about any family history. If he
Yeah,
is
very important.
if he is taking any other medication, and also personal history like taking any alcohol or any smoking habit.
Yeah, actually, I didn't get time for it. Okay.
Okay.
Yeah. And all other, was the diagnosis right?
Actual diagnosis is acromegaly,
But what about this polyuria?
maybe associated with diabetes mellitus he is developing. His RBS wasn't fit.
So my diagnosis is wrong, I think. What
You
could have
could,
been?
for the same side, you could say that my diagnosis is acromegaly. It might be associated with multiple endocrine neoplasia syndrome.
Yeah. Okay, so that was important actually. I actually couldn't get it. I was a bit confused because
There wasn't any other signs of hypercalcemia like any
yeah, there
abdominal pain,
wasn't.
any
So
depression.
I just got it was a symptom of hyperglycemia. Okay, but actually I couldn't just get it. But I could have mentioned, I think, no, that this can be associated with MEN syndrome since he has
Yes,
polyuria. Yeah.
yes,
Okay.
yes.
Okay. So okay, thank you. Can we go move to the next case?
Okay, go for the next case. Here is your next case.
I think this is a bit difficult one. উনি এগুলো কি ইয়া থেকে দিচ্ছ নাকি?
Recording running.
ও সরি। Shall I start?
You have 1 minute remaining.
Okay.
Start now.
Yes. Okay. Hello, I'm Dr. Trivedi, a doctor working here today. May I confirm your name and age, please?
Doctor, my name is Tom Holland and I am 28 years.
May I know how can I address you?
Please call me Holland.
Yes. Okay. Mr. Holland, today we are going to discuss about your health issues. Is that all right?
Okay.
May I know more in details about your health problems?
Yes, doctor. I came to the emergency department with my tummy pain. I developed it yesterday night, and that was somewhat more severe pain, and especially on my left flank region. And I felt this pain before, but this time it was very severe. And also, I noticed that I am passing red colored water. And for that, I came to the emergency, and they kept me admitted, and they gave me some medication, some IV medication, and after that, my pain was controlled, and but I am also still losing my losing the blood in my water, and for that they sent some blood test and some test for my water work.
Okay. I'm sorry to hear that. Well, may I know that where is the tummy pain located? The whole tummy or any part?
On my left flank, I think.
Okay. And well, you told that you had this type of episodes previously also. May
Yes,
I
doctor.
know when did that occur again?
About 6 months ago, and one was about 1 year ago. That about I have this type of pain about 4 or 5 times before.
Okay. And where did you feel notice any redness in your water work in that times also?
Yes, but that was very little, and my GP suspected that that was due to the infection in the water work, and for that he prescribed diabetic, and that helped me. Prescribed diabetic and some painkiller that helped me at the time.
Okay. Okay. And well, you told that there is in a left side of a tummy. And can you please describe the pain for me?
It's out of severe pain.
Severe pain. Okay. Does it move down to your groin region? Have you noticed that like that?
Yes, doctor. Sometimes.
Okay. Okay. And in radiation to any other place or just there?
No,
Just that groin region.
no other,
Okay.
just on my groin.
Okay. Okay. If I want to you to grade it, like 0 is no pain and 10 is the highest pain, how would you grade it?
6 or 7.
Okay. And okay. And may I know that for how long have you been feeling this pain this time?
I started yesterday night, and after coming to the emergency department, they gave me some painkiller medication. After that, I feel better.
Okay. And okay. And mm, may I know that you told that you had observed some redness in your water work. Can you please tell me that when is that redness noticed? At the beginning of your water work or throughout the water work?
Throughout.
Throughout. And may I know that is this frank blood or anything like brownish in color or something like
No,
that?
I think it is frank blood.
It's frank blood. Okay. And may I know that have you noticed any changes in your mood recently?
No,
Okay. And any problems with your any problems with the digestion?
no,
Okay. And okay. And do you feel any joint pain?
no,
Okay. And any nasal stuffiness?
no,
Any bleeding from any other orifices
no,
like or anything?
no,
Okay. And have you ever noticed anything like any yellowish coloration of your body?
no,
Okay. And during this episode, this time, did you uh, had any fever, raised temperature, or
no,
any chest infection previously,
no,
or any bowel problems recently?
no,
Okay. And And okay, and do you feel any muscle cramping?
No.
Okay, okay, and okay, and okay, and have you noticed any loss of weight
No.
recently? Okay, and any sensation of any lumps and bumps in your tummy?
Yes, doctor. For
Okay,
last 1 year, I have noticed that I have a lump on my left side, and recently I noticed that there is also a lump that is developing on my right side also. And I
okay,
heard that it was something due to my overeating.
okay, okay. And may I know that do you have anyone in your family having this type of problems with problems in your in their water work or any known kidney problems?
Yes, doctor. My elder brother have a kidney problem, and my father also have a kidney problem. They call it polycystic kidney disease.
Yes, yes, yes. Okay. And may I know that do you have any problem with your headache
No.
or anything like that? Okay. And okay. And may I know that are you on any medication recently?
No.
Okay. And may I ask you some personal questions?
Okay.
Do you drink alcohol?
No. 2 minutes remaining.
Okay. And do you smoke?
No.
Okay. And okay. And may I know what you do for a living?
I just after graduation, I am looking for a job. I'm actually doing nothing.
Okay. Okay. That's all right. Now I would like to examine the patient.
Okay.
Okay. With the permission, I would like to touch your face to have a look. Just look up uh, for anemia.
Mildly anemic.
Okay, and just lift just stretch your arms and then spread out your arms, spread out your fingers for any tremor.
No.
Okay, and do you have any pain in your legs? I would like to look for edema.
No.
Okay, and now I would like to expose you and just I would like to feel your tummy. Is that all right?
Okay.
Okay, now going to the level, I will just have like to do the ballot testing. Uh,
Okay.
uh,
Palatable.
okay, ballotable. One side or both side?
Both side.
Okay, and okay, and now I would like to just put my stethoscope and can you please sit down for me?
Okay.
Okay, and I will just going to listen to your back. Okay, to find out whether there is any yeah present or not, any clips present or not.
No.
Okay, okay, and I'm just going to scratch your legs to find it will be a bit uncomfortable, but it won't be problematic. Is it all right?
Okay.
Okay, what about is plantar?
Flexor.
Okay. May I know what your concern is?
Oh, why I am having this, doctor?
Yeah, yeah, I can
The
understand
kidney
you.
stone.
Yeah, yeah, I can understand your concern, but as long as I have taken history and examined you, I think that you
Time
might
up.
be suffering. Okay, okay.
Wait. So, what is your diagnosis?
Well, actually, I think that the diagnosis is adult polycystic kidney disease.
Okay. What are the positive findings for adult polycystic kidney disease in this patient?
I think the most important positive finding is the family history in this patient, and also the ballotable kidney that I have found in both sides. That is also also goes in favor of polycystic kidney disease, and I think these are more important. And I think hematuria and abdominal pain. These can also be features of polycystic kidney disease, and this anemia can also be important here.
Okay. So, for this patient, for acute management,
Mm. Sorry.
for his management,
What is the management?
yes.
Okay, it's patient education and counseling. Specifically in this patient, genetic counseling would be important. Okay, and then some specific investigations should be done to confirm it, like ultrasonogram of ultrasonogram also, and then specific treatment. And for specific treatment, I think in this patient, uh, things will be important. Whether uh, and first of all, to control the pain, I think analgesics, NSAID can be given, or some analgesics can be given, and then we would also have to check the BP regularly if there is any raised BP. Okay, then we can also think about ACE inhibitors, I think. And if the renal function is compromised, then we can also think about some renal replacement therapy in form of dialysis or renal transplantation, I guess.
Okay.
Okay.
Fine. Thank you.
Okay.
So your history technique, that was fine. Just one thing, that have you asked that have you ever undergone any scan for polycystic kidney disease in this in your life, as his father and his elder brother has?
That was a grave mistake. That
Yes.
should have been.
And also, how did the pain started? Following any trauma or just spontaneously?
Yeah.
Patient was playing a ball at the previous night, and after that he developed pain.
Yeah. That was a wrong, very grave mistake.
Okay.
Okay.
And also for this patient, his BP was given, that was 90 or 60.
Yeah, I noticed that. So, what to do with that? Actually, this
If
BP.
this patient have developed any acute kidney injury, if there is any significant blood loss or any significant fluid loss, you should assess promptly or urgently about that.
Okay. So this is a grave mistake, because in this case, I think I should first have to look at his dehydration and also pulse first.
Yes.
Am I right?
And you should have asked about his current BP.
Yeah.
You should have asked about his current BP and his urine output.
Yeah. This was a grave mistake, actually, because this patient, the total management would have been different. That's a grave mistake. Yeah.
Patient has a shock. Okay.
Yeah.
Otherwise, this was fine.
How I don't think this was fine, because this is the gravest mistake. I think I didn't check those things. Yeah.
No, we did great.
Okay. And I think I